Blue Cross ambulance.
All over London, Blue Cross animal ambulances collect a range of poorly pets for urgent treatment.
Come on, Jen.
Ready to receive them are two of Britain's busiest animal A&E departments, where the charity staff and volunteers
I'm sorry, I'm holding a puppy. I can't do anything.
Stop it.
work round the clock to quickly diagnose and treat more than 19,000 animals a year.
Can you go to an emergency, Southwest 11?
Through the A&E doors comes everything from sore paws
He's done some serious damage.
to life-threatening injuries and those more embarrassing illnesses.
It's the anal gland smell.
We have wee. Hooray!
And no 2 days are ever the same.
Oh, it's lovely. It's just the worst job ever.
At least I've not got pooed on just yet.
Good afternoon, Blue Cross Victoria. How can I help?
We'll be there between 9 and 12, like always.
So we're going to go and collect Zena and Toby Lloyd, two cats from the same house.
Blue Cross ambulance driver Lee is on a busy shift and en route to his next pickup.
Toby's a diabetic, so he's on insulin. His housemate, Zena, she's got sore eyes apparently, according to the owner. Nearly all of our ankles are immobile and housebound, so their pets are like their babies. So it's like if your child weren't well, the first thing you would do is phone up your GP and go, you know, my child's not well, I need it to see him. But obviously, they can't get into us, that's why they're ankles.
Rena and her husband are disabled and rely on the Blue Cross to help them with all their pet cats.
We've come for Toby and Zena. Is he eating okay, drinking okay?
Yeah.
And has he been getting his insulin okay?
Yeah.
He's still on the reduced dose, isn't he?
Like us, diabetic cats need constant monitoring to avoid further complications.
Okay then. And with Zena, you say she's got a sore eye?
Yeah, the same right eye, I think.
Oh, right. Okay. Where are they hiding?
Toby's outside
Okay.
and Zena's disappeared.
But to take them to the hospital, first Lee has to find them. And sometimes cat patients in particular don't play ball.
Where's your sister hiding? Cats tend to be more naughty because they're quite highly strung, some of them. And also they get really good at hiding. You go around the house, they hear that doorbell, they're gone. She wasn't out there, was she?
I have been at someone's house trying to catch a cat for about half an hour before.
Where is Zena?
Probably she's hiding behind there.
You know, you're climbing on wardrobes and behind wardrobes, under sofas, trying to find them. Hey, Zena.
Lee.
Are you pretending to be a figure?
Wait.
Hey?
Lee?
If I...
All right, Lee.
Come on.
Zena. There you go, see. Good girl.
Right, well, I'll take him in, get the vets to check him over, and we shouldn't be too long.
Okay.
All right, you take care. See you in a little while.
At the hospital in Victoria, reception staff must be prepared for anything. And an emergency patient has just come through the doors. 9-month-old Bambi has been hit by a car and is in shock. Each year, on Britain's roads, over 4,000 animals are involved in traffic accidents.
Oh, bless her little. What happened?
She ran out the road into to chase a squirrel.
You're very calm for it.
Oh, God, it hasn't been a good morning, has it?
No.
We do see a lot of traumatic injuries here, but accidents will always happen. Things will always run into the road and get hit by cars. And they're some of the most traumatic injuries that we see.
Bambi is rushed through to see a vet to be urgently assessed. Bambi's owner, Kendall, has a worrying wait as vet Jill checks her over.
Oh, and you say it's the back one that it's worse. Well, I'll have a look. Come here. That hog's really swollen. Come on. And everything.
There are obvious signs of external
With
trauma.
pain relief.
But any internal injuries will be more difficult to identify.
Just gonna pop her on the scale. Good girl, I know. You're being very brave. Why would you go after the squirrel?
So we get a fair few RTAs, road traffic accidents, and those can be quite upsetting and they can be a challenge to manage as well, especially if they're painful or if they've got really nasty injuries. It's not very nice to see.
All right. Oh, we need to sedate her to have a proper look at the bones just to try to assess.
Do you think it's broken?
It does.
I think it does.
It looks quite swollen. So I don't even think this is going to be a sedation. This will need quite likely to go for a full general anesthesia just to have a proper, because she seems quite painful, definitely. It will be only after the x-rays we can know. Okay.
Bambi will be kept in overnight to have her injuries assessed.
All right.
It's going to be an anxious wait for everyone. Back downstairs in the main clinic, ambulance driver Lee is checking in scaredy cats Zena and Toby.
Morning.
It's up to vet Poppy to take a look.
Toby and Zena Lloyd.
Ah, okie doke. Who do you want to see first?
We'll start with Toby.
Toby's diabetes means he needs his blood sugar levels regularly monitoring.
So, insulin checkup.
Yeah, the owner's reported though the last week he's been coughing and sneezing.
Okay.
Good boy.
Oh, he's being very brave, isn't he?
He's really well behaved.
He is. There we go, that's all we need. So it's a little bit high. Ideally rechecked perhaps in a couple of weeks just to make sure that his insulin's all doing okay.
Next, it's his sister Zena's turn.
Owner phoned up and reported that she had a sore eye.
Okay.
When I got there this morning, she said her right eye seems to be shut more than the left.
Okay.
Good girl.
Yeah, okay, I know.
Cats' eyes are a good indicator of their general health, so it's important to act quickly if there's any sign of infection or injury.
No, so I can't see any scratches or anything, and the surrounding structures of the eye, so sort of like the conjunctiva and stuff, don't look any reddened or inflamed or anything. Okie doke.
Come on, you can go back in.
Home time.
There you go. Good girl.
Lee can take the cats home and reassure Rena that her beloved pets are healthy.
The ambulance service is an important part of the hospital, and people do appreciate that we have the service. Not everybody is entitled to have it, but the ones that are, I think they really like the ambulance driver to go to the house and see the environment. And also as a vet, it's important to have eyes in the house.
Hey, you all right? Yeah, not too bad. Come on then, Tina. Yeah, they're okay. So we don't need to see Zena again unless you're worried.
Okay, all right.
All right then. Right, you take care, and we'll see you in 2 weeks.
Good afternoon, Blue Cross Victoria. How can I help?
Back at the hospital in Victoria, vet Charlotte is about to give emergency admission Bambi a full examination.
It's all right, sweetie pie.
There isn't really such a thing as a typical day. It is different every day. If you're consulting, you come in and you start just going through the list of all the clients and animals coming in.
Can you come with me?
If you're operating, you come in and again you work your way through everything that's going on. But one of the biggest things you learn is to always prioritise the sickest animals. So we always try and get the sick ones in first and then the less urgent ones later in the day.
It's very sore.
Bambi is under general anaesthetic, so Charlotte can check her wounds thoroughly.
She's got really nasty abrasions to the skin here, down to the muscle layer there. Ooh, that's painful, right through. And then some more superficial wounds all down that front leg as well. It's very sore.
The external wounds look fixable, but it's critical that any broken bones or internal bleeding are pinpointed quickly with an X-ray. As Blue Cross ambulance drivers, Lee and Sonia are occasionally called on to go further afield than their usual patch in London.
Did I tell you about when I was driving up in Stoke?
No.
I don't know the area, so I put my sat-nav on. In 200 yards, turn right into Satan's Road. I was like, what the hell? There's a Satan's Road in Stoke. St Anne's is the road. But the way it said it was Satan.
Who's this, Brecon?
See Brecon. That's all he comes
Who's that?
See Brecon. Good morning.
Up in Grimsby,
Oh, bless you.
there's no shortage of unpredictable and rather unique cases.
You are cute. Don't let anyone tell you different.
Waiting in reception is older lady, 6-year-old West Highland Terrier Tinky,
She's very nervous today.
who's here for an essential but delicate operation.
She's had it for possibly over 6 months, bleeding and mess coming from the back end.
So Tinky is in today for a vulvoplasty.
Designer vagina.
We're going to be tightening the skin so there's no folds, and hopefully that should reduce friction and soreness and be a lot more comfortable for her. No, this is definitely not a common surgery here. We've got Tinky.
Yeah.
Morning, you all right? Lovely. Hello, Tinky. Right, so Tinky is in today for a general anaesthetic, so she'll be fully asleep. When was she last fed?
Yesterday. She had a sausage at 8 o'clock with a medication.
Whatever works.
Oh, come here, baby. They're part of your family. You know, they sleep with you, they're with you 24/7. They're family, aren't they? Oh, my baby. Go on, then. You've got to go.
Right, we'll go find her a nice comfy bed. Come on then, sweetheart. Tinky. We'll go get some blankies, won't we, Puppet? Come on then, my love. Right, sweetheart. Come on,
we
then,
better
Puppet.
go, 'cause
We'll
she'll...
find a bed.
She'll panic, won't she?
Come on then, darling.
She's an old girl. Anything could happen. So, fingers crossed.
And doing general anaesthetics for these older animals can be kind of a little bit of a nerve-wracking thing because they can have a lot of stuff going on, and you kind of have to prioritise if it's kind of worth doing a certain procedure to benefit the animal's quality of life.
But Tinky has been in pain for several weeks, and this operation will be life-changing for her.
So what we need to do is to remove that excess skin, that skin fold, basically, and leave the vulva more exposed to air, and it will dry and heal quite all right, hopefully.
Even for an experienced vet like Lynn, Tinky's nip and tuck isn't a common procedure.
We don't see quite a lot of them, to be honest. I think this is the second one. So she will struggle initially with things like visiting the toilet. She might be more comfortable in a lying position, but yeah. We call them the joys of womanhood.
It's a long, delicate operation. Afterwards, Tinky is taken to recovery for some well-earned R&R. Back in London, another dog is in theatre.
Chest x-rays.
After being hit by a car, puppy Bambi is having an x-ray to check for life-threatening injuries.
It's a little bit awake, it's a bit tachycardic. Even if the breathing's normal, we always like to get chest x-rays just to make sure that there's no invisible trauma, bruising. You don't always find what you expect when you operate. You can come across things that you weren't expecting and hadn't prepared for, and then you have to think on your feet. She hasn't got any internal trauma, which is very lucky, considering all of the road traffic accidents we see with extensive internal injuries. On
5 mils per kilo per hour. She's done pretty well to just get away with superficial injuries.
With a clean bill of health on the internal side, Bambi's foot can be cleaned and stitched.
So I'm just trying to scrape out all of the bits of hair and bits of road that have got trapped inside this wound. I'm just getting rid of any sort of unhappy tissue that's on the top of the wound here. Just we want nice, fresh, clean tissue to stitch it up. Feet are not ideal places to have wounds though because they're so mobile. It's not like with a human leg where you can just put it up on the sofa for 6 weeks. They'll be back on feet in no time.
While Nurse Sophie takes Bambi to recovery, Charlotte gives her owner, Kendall, an update.
Hello there, it's the vet here calling from the Blue Cross. The good news is that it looks like she hasn't got any internal trauma, which is very lucky. We've taken some x-rays as well of her right hind leg. And again, luckily, it doesn't look like she has any damage to her bones there.
Okay, so, oh, that's wonderful. Honestly, all good news. I'm really happy.
Yeah.
Take care. Bye.
Thanks then. Bye, you too. Bye.
Bambi will be carefully monitored for another 24 hours until she's stable enough to go home. Up in Grimsby, the animal hospital is as busy as ever.
We've only got 3 nurses today because we've got 2 off.
And not every patient has a physical injury. Some arrive needing help for more emotional problems.
Any problem with his breathing?
Hello. Any recommendations as what I can give Betty to calm her down?
Is it the fireworks? They can give her something, but it's that she needs to see a vet.
Dogs have exceptional hearing. They can hear noises from 4 times the distance we can, so they're incredibly sensitive to fireworks.
She was born actually on firework night, so you'd think she would be used to it, but
Deborah has brought in her 7-year-old staffy, Dottie. She might look tough, but she's terrified of loud noises, especially fireworks.
The anxiety for dogs is here quite often us. You know, they see us and that's enough to make them anxious, unfortunately. But yeah, they get very anxious about fireworks, which is obviously seasonal at the moment, but the noise phobias are very common in dogs as well.
Right, we've got Dottie. Fantastic. Hello, there we go, perfect. Oh, sweetheart, don't look so worried, it's okay. Right, so what can we do for poor little Dottie then?
it's the fireworks.
Oh, bless her, okay.
She gets in the right state with herself. She won't calm down. She'll chew to get out, to get close to you. Or...
Right, okay, she wants to be with you when these things are going on.
It's awful for her.
Poor little mite.
Yeah.
Bev gives Dottie a quick examination to check her physical health.
And we'll try and have a good feel of her tummy. And has she been neutered when she was younger? Fantastic. That's what we like, isn't it?
You did it a couple of years ago.
I wonder why you don't like coming to see us, eh? Oh, sweetheart. She looks absolutely fantastic health-wise. Nothing at all I'm worried about with her. Because we're sort of so close to bonfire night, I think, as you say, she's going to need something just to try and ease the stress up for the night.
Bev prescribes some medication to get her through the next bonfire night, but has an idea to try in the future.
So there's lots of things available. So there's sort of certain CDs that you can get that basically you can play sort of fireworks and similar noises at a really, really, really low level. And in theory, if you do this over weeks and weeks and they realise that it's nothing scary, you sometimes can get them that they're near enough used to the noises. And I give her food and treats for being in those, and then hopefully it'll help her kind of feel at ease a bit.
Hopefully, a stress-free Dottie will now be fully prepared for next year's bonfire night. A transformed Tinky has been recovering overnight from her operation and is waiting to go home.
We've got Tinky to collect. I think Tinky will be happy to see all you guys. Come on in. That's lovely to see, especially when you discharge the animal out of clinic. Who's this, Tinky? Oh, look. Being able to send that pet off when it's wagging its tail and so excited to see their owner, that's lovely to see as well. She's been really sprightly, has pelted down that corridor to get here, so good girl.
Relieved. It's all over and now it's all about healing. So just get her home, get her curled up for a few days and back to normal. Fingers crossed.
So are you just wanting to head out then?
After 2 weeks at home with her family, Tinky was back to her old self. In London, it's time for another brave patient to go home. Excited puppy Bambi.
Okay. Oh my goodness. Gently, gently.
I don't think she knows that she's got an injury, does she?
She's nuts.
Yeah, I see that.
She's been nuts.
Ah, look at her now.
There you go, I'll give her you the lead. She's been such a pleasure to have in.
Oh, well, you've been so lovely to
Are you
her.
staying with us? Come on. Come on, little rat.
Yeah, it's so nice to get her home. Really lovely. The children have missed her so much. Oh God, she's already nearly broken that. That'll take about one day, won't it?